In this week's Cardiology Countdown, we have two articles from the New England Journal about angiotensin receptor blockers. So starting with the number 3 pick is the so-called roadmap study that looked at the use of an ARB, in this case olmesartan, to prevent development of microalbuminuria amongst patients with diabetes. Now that's been a very potent risk factor and something that can be potentially avoided with use of ARBs. And so this was studied in a randomized double-blind trial of 4,447 patients with diabetes and normal microalbuminuria for a mean of about 3 years of follow-up. And use of olmesartan did delay the development of microalbuminuria by about 5 months, and that was a 23% reduction in time to developing microalbuminuria that was statistically significant. For looking at cardiovascular events of cardiovascular death, MI, stroke, those were not different, and unfortunately the rate of fatal cardiovascular events was higher, especially in those who had known cardiovascular disease at baseline. So a bit of a cautionary note that will deserve very careful attention before embarking on that approach to preventing microalbuminuria. At the number 2 spot is the active eye trial that used the angiotensin receptor blocker irbesartan in patients with atrial fibrillation. This was studied in the ACTIVE program, where we've heard about the use of clopidogrel and aspirin, or warfarin versus clopidogrel and aspirin, for prevention of stroke. Here, use of ARB was thought to potentially prevent atrial fibrillation or cardiovascular events. It did neither. There was no difference in the rate of cardiovascular death, MI, or stroke. There was a lower rate of first hospitalization for heart failure, although that was not one of the primary or secondary endpoints, but it was a component of the secondary endpoint. Overall, it was well tolerated, but they saw no benefit in preventing development of atrial fibrillation. And as such, no new indication, I think, for AFib patients and ARBs. And the number 1 pick is from JACC this week that touches on a hot-button topic. It doesn't answer everything, but looks at whether there should be mandatory ECG screening of athletes with the goal of preventing sudden cardiac death. In Israel, this study comes from, there was a regulation and a law put in place for mandatory screening in 1997. And so the authors studied before and after whether there was an apparent difference in the rate of sudden cardiac death. Interestingly, the screening involves a physical ECG annually and stress testing every 4 years for competitive athletes. So they looked only in the media, saying that sudden deaths are covered by the media, and that was the basis of their finding 24 sudden cardiac deaths. And when they normalized that to the number of athletes, they found no apparent difference in the rate of sudden cardiovascular death before or after this law. Now, it's not a perfect data set by the way the data were collected, but fuels the ongoing debate as what's the best way to screen for and avoid sudden cardiac death amongst athletes. So for this week's Cardiology Countdown, I'm Chris Cannon.